Welcome to Thermography Medical Clinic's webinar series. Today, I'm going to be talking about the 4 R's, my treatment philosophy. My name is Sharon, and I am a registered homeopath, a holistic nutritionist, and a medical thermographer. I am the founder and clinic director of Thermography Medical Clinic since 2010. I am an interpreter for Thermography Medical Clinic. I was the clinic founder and director of Divine Living, which was a natural health clinic from 2005 to 2022. My philosophy is a personalized, proactive, and preventative approach to healthcare. The 4 R's. Have you ever wondered where to start when it comes to creating a treatment protocol for your patients? Do you have an organized and strategic approach, or do you just throw supplements at your patients hoping that something will help? This webinar takes you through the method that I use to assess my patients and design an effective treatment protocol based on a thermography assessment. So what are the 4 R's to recovery? Reduce, remove, repair, and restore. First, we have to reduce inflammation in the body. I describe it as calming the body and taking the edge off. Second, the underlying cause of the inflammation has to be removed. Third, the damage that the inflammation has caused needs to be repaired. And last but not least, we have to restore nutritional deficiencies. So what is inflammation anyway, and what is the role of inflammation? Acute inflammation is a normal healing response, but inflammation that becomes chronic is the precursor to the disease process. Cancer, arthritis, heart disease, stroke, diabetes, cognitive decline, fibromyalgia, chronic digestive disorders, thyroid dysfunction, chronic infections, all of these conditions are caused by chronic inflammation. Early detection of inflammation and the cause of the inflammation may help you prevent negative health conditions from developing. Did you know inflammation always has a cause? We have to ask why. Why is there inflammation? Why is the body stressed? Why is this person so sick? And why is this person not getting better? So, inflammation is the response to something going wrong in the body. That could be anything from stress, injury, toxins, environment, poor nutrition, emotional stress. To help our patients recover, we need to be able to assess the health of our patients and identify the underlying cause of the inflammation. So how do you, as a practitioner, evaluate the state of health that your patient is in? How do you identify the areas of the body that are asking for help? And how do you begin to answer the questions, what is wrong? And where do I start? What are the tools that you use to give you and your patients a picture of their health? Do you use a health questionnaire, blood work, an x-ray, blood pressure? Perhaps you use hair analysis or biofeedback, blood analysis, or iridology. But do these tests really give a whole body health picture? Do they provide enough insight about inflammation and the cause of that inflammation? So why is testing so important anyway? Why can't we just base a treatment protocol on symptoms that the patient tells us? Well, here's why. Testing is important because it allows us to be able to identify areas of concern that need to be addressed. Patients often leave out important information in their questionnaire. Therefore, we should be guided by test results more than by what the symptoms are. Testing with thermography gives us a visual picture of how the body is functioning, and it allows us to identify the underlying cause of the patient's complaints. Why is thermography so valuable? Simple. Thermography shows how our body is functioning and provides an objective and visual assessment. This allows us to see what is wrong with the patient, identify the underlying cause of the problem, and monitor the progress of a treatment protocol. So getting the priorities straight is critical, but why is that so important? Prioritization is not just about being organized, it also plays a significant role in our personal and professional lives. By giving priority to the right tasks or issues, we can make better decisions, enhance our efficiency and productivity, and ultimately achieve our goals, including health goals, more effectively. When it comes to our health, the body tells us what areas need to be addressed first, so basically what the priorities are. Many people have similar symptoms, but totally different causes, and everyone needs a treatment plan that is unique to them, which is called personalized care. We should always ask why. Why does someone have inflammation, and why does someone have a health condition? What is the cause? Symptoms versus cause. What's the difference and why does it matter? Well, it matters because without knowing the cause, you will always be addressing the symptoms and your patient will never fully recover. Let's look at some examples. Let's think about someone who has vitamin and mineral deficiencies. Do you make them take all the supplements that they are deficient in? Or would you dig a little deeper to find out why they have deficiencies? Some underlying causes of vitamin and mineral deficiency could be due to digestive issues like leaky gut or poor absorption. Perhaps there are other imbalances such as bacteria overgrowth. Maybe liver and gallbladder function is an issue. Perhaps the stomach or pancreas is stressed. Or maybe this person just has a poor diet. But we have to know why. What about someone who has chronic pain? It's critical to know the cause because there can be so many reasons that this person is suffering. For some, it may be that there is injury or imbalances related to the musculoskeletal system. For others, the cause of pain could be poor digestive health, hormonal imbalance, exposure to toxins, dental infection, or chronic emotional stress. Let's talk about heart disease. Heart disease could be a symptom of a bigger underlying problem. The source of the problem could be dental infection, chronic stress, poor digestive health, toxins. So it's important to look at the big picture before implementing a treatment protocol. Without knowing the cause, it's difficult to provide a roadmap for their health journey. Implementing a treatment protocol, there is a method that works. So how do you put a plan into place? I want to show you the method that I have used forever, and patient outcomes have been amazing. It seems like such a simple approach, and it is. I stick with my philosophy, which is personalized and preventative approach to healthcare. Address the cause, heal the patient. Let's take a look at a case study. This patient reported chronic joint pain, muscle, and all over body pain. Let's take a closer look with thermography and see if we can uncover the underlying cause of her symptoms. You may have seen a brief version of this case study in a previous webinar titled Why Everyone Should Have a Full Body Study. So here I'm going to go through the case in a more detailed way to show you how I worked to help this patient become a happier and healthier version of themselves by following a personalized health plan. So this patient came in and reported concerns related to frequent headaches, neck, upper and lower back pain. She stated that she was stiff all over and had severe muscle aches all the time. She consulted with a structural therapist who believed that it was a misaligned spine. She had been having regular chiropractic and massage treatments with no relief. So she also complained about severe breast pain and difficulty breathing. Let's look at the findings in her study. The findings in her thermography study indicated the following areas that needed attention: the digestive system, some bacterial imbalance going on, the liver, and the adrenal glands. She had an overactive nervous system. There were no patterns that indicated imbalances related to the spine. So I concluded that in this case, musculoskeletal pain had a deeper underlying cause related to the condition of her digestive system and due to her nervous system being stuck in fight or flight. These are her initial images. You can see that there's some inflammation around the mouth, which indicates dental inflammation caused by teeth clenching. Teeth clenching itself can be the result of stress, or it can be a symptom of bacterial imbalance in the body. In the lateral and posterior neck images, there's a lot of inflammation related to lymph congestion. And in the upper back, that irregular misshapen pattern indicates soft tissue inflammation caused by lymph congestion. In the chest, those branching and scattered patterns also indicate inflammation caused by lymph congestion and adrenal stress. Lymph congestion indicates that the body is having a hard time keeping up with toxins in the body. In the breast, the inflammatory patterns related to lymph congestion are observed in the anterior and in the lateral views. And in the abdomen, the patterns indicate inflammation caused by adrenal stress and bacterial imbalance. The lower back also shows soft tissue inflammation caused by lymph congestion, and the trunk images give you a clear picture of how much inflammation there is. The pattern in the hands are actually normal, and in the lower extremities, she does have some circulatory issues, likely due to the varicose veins. My priority was to address the overwhelming inflammation. I also used other tests to correlate my findings, and you may use other tests too. All of these tests work together to assess the health of the patient and determine the areas of priority. This increases their compliance with your prescribed plan of care. I use a system called biofeedback. and these are the results of a biofeedback device that I use to assess my patients. It is a simple chart that gives a visual picture to the patient. This easy to understand chart shows all of the systems of the body on the left side of the chart. The results are color-coded like a stoplight. Systems that have a score in the green area are considered balanced. Systems that are in the yellow are stressed. And systems that are in the red are weak, and they need attention. The further towards the right side of the chart, the higher the priority for those systems. You can see how the most stressed system is the liver. Next, the endocrine system, the kidneys and the adrenals, and then the digestive system. This confirms what the thermography study indicated, so my patient was now super motivated to get started. After discussing the findings of the thermography study and the biofeedback, I learned that she had been going through a very stressful time related to work and her home life for over a year. We talked about how a constant state of fight or flight leads to chronic inflammation in the body. It's extremely important that people understand how stress impacts their physical health. Without this knowledge, they don't recognize the importance of supporting their body during stressful times. I realize we can't eliminate stress, but we can support our body so that our physical response to the stress takes less of a toll on our health. Reducing inflammation, step number 1. So let's get started. Remember that your role as a healthcare practitioner is to lead your patient on their health journey. Your goal should always be identify the cause, address the cause, and heal the patient. It's critical to convey information to your patient and explain to them how their health is being affected by underlying issues that need to be addressed. This facilitates patient engagement and motivates the patient to stick with the plan. So the first step is to reduce inflammation in the body, and here is why. Chronic inflammation keeps the immune system on overdrive, and this leads to long-term unresolved stress on the body, and it drains the capacity of the immune system to deal with other stressors. Chronic inflammation disrupts the gut flora and ultimately makes the body toxic. This causes even more inflammation, and the cycle continues until the cause of the inflammation is addressed. While it's important to address inflammation, it's critical to resolve the underlying cause of the inflammation, and that is exactly what we set out to do. My initial recommendations focused on reducing inflammation, and for this, I recommended a comprehensive medical food called Ultra Inflammix formulated by Metagenics. I wanted to support the liver, so I chose a product called Advoclear, also formulated by Metagenics. I also chose to support the adrenal glands, calm the nervous system, and by calming the nervous system, this also helps to reduce inflammation in the body. For this, I recommended a nutraceutical called Serenogen, also formulated by Metagenics. So let's take a look at her biofeedback chart the second time around. On her second visit, she reported there were some mild improvements in her symptoms, less overall body pain and fewer headaches. Complaints like the breast tenderness and shortness of breath were still problematic for her. So repeating the biofeedback test allows us to see how things had changed. Here's the results of her second test. We'll take a look at a side-by-side comparison so the change can be seen more clearly. The first chart was the initial test, and the second chart is her follow-up. You can see the remarkable change in her liver function. However, we still have some work to do, and we still need to support the adrenal glands. I also wanted to turn my attention to the lymph system and the digestive system. So here is what I did, and here is why. The next step in our journey is to remove toxins from the body. In the beginning, I chose to support the liver. It is likely that toxins were removed from the liver and other systems into the lymph system for removal from the body. So it's time to give the body a good cleanup. I wanted to address the bacterial imbalance in the body, so I chose an antibacterial formula. I used a product called Candibactin BR, formulated by Metagenics. I also put her on a whole body balanced detoxification. This detoxification is gentle, and it supports the liver and the kidneys. I chose to keep her on the Serenogen to continue to support her adrenal glands. So let's check in again and see how things look this time. I again used the biofeedback to take a quick look to see if things were still heading in the right direction. After following the protocol for a few months, she reports her pain is gone and that she only has some stiffness when waking up in the morning. Her headaches are gone, the breast pain is minimal, and the shortness of breath only occurs with exertion or when she tends to overdo it. Let's look at the results here. I'm going to show the results side by side so you can see for yourself, but with each visit there are improvements. When you give the body what it needs and what it can handle, the results are astounding, and the body has an ability to heal itself if you pay attention to the priorities and address the underlying cause. Our comparison confirms a significant decrease in inflammation. Let's recap. On the first visit, we prioritized reducing inflammation, supporting the liver, and supporting the adrenal glands. On the second visit, we shifted our focus to detoxification while supporting the adrenal glands. We can keep working on reducing inflammation, keeping the detoxification pathways open, and start moving towards healing the digestive system. The next step in our journey is to repair the damage. I chose to continue supporting the liver, the adrenal glands, and I chose to keep her on the nutraceutical to keep inflammation levels down. The new additions focused on healing the intestines and reestablishing a healthy microbial environment in the gut. For this, I chose L-glutamine and probiotics. So let's check in again and see how things looked this time. I again used the biofeedback to take a quick look to see if things were still heading in the right direction. This is the first indication of a health journey success. If you remember, green is good. All of her systems are in the green, which means this patient is heading towards balance. This is why I love thermography. If you can't see it, you won't believe it. But if you can see it, then you will believe it. Let's now take a look at her follow-up thermography study 1 year after starting her health journey. The first row of images are the initial images, and the second row is the follow-up. I am hoping that visually you can see the change in the images. The dental inflammation is no longer there. The inflammation in the lateral neck caused by lymph congestion is no longer there either. You can see in the posterior neck and the upper back that there is a significant improvement, and in the chest, the branching and scattered patterns have also gone away. In the breast, there's also a significant reduction in inflammation. And look at those abdomen images. All the inflammation is gone. Similar positive results are observed in the lower back and even in the trunk images. The hands were normal to begin with, and so the follow-up images are the same. And we see the same patterns in the legs in this follow-up study. Those vascular patterns are varicose veins. Follow-up study findings. What do we see and how does she feel? In her thermal images, we see a significant reduction in inflammation, and she reports feeling so much better. What's the last step? The last step in the 4Rs protocol is to restore nutritional deficiencies or replenish the body. To restore nutritional deficiencies, I chose Phytomulti, which provides whole food nutrition and antioxidants, also formulated by Metagenics. I also put her on SPMs, which are derived from omega-3s, to resolve inflammation in the body, also formulated by Metagenics. I decided to keep her on the L-glutamine, the probiotics, and the Serenogen. We chose to continue to support her digestive system and her adrenal glands because this patient continued to have a high level of stress. So what's the conclusion? If you're a practitioner, I encourage you to look at the cause of your patient's complaints with thermography. In this case, the patient's musculoskeletal complaints were not caused by imbalances in the musculoskeletal system at all. Rather, they were caused by inflammation in the body. Though prolonged emotional stress led to an overactive nervous system, which led to dysbiosis, which led to an accumulation of toxins in the body, which led to chronic inflammation, which caused all of her symptoms. So what can thermography do for you? Thermography can help you to evaluate and assess the health of your patient, identify the underlying cause of the problem, monitor the progress of your patient. In other words, thermography takes the guesswork out of identifying the problem and finding the solution. Are you concerned about your health? To learn more about how thermography can help you, the following videos are available on our website, thermography.medicalclinic.com, and our YouTube channel. For more information, you can visit our website, thermography.medicalclinic.com, and follow us on Facebook and Instagram.